Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Each week we cover topics related to the pre-med journey to medical school and beyond, from the MCAT to completing your application and from starting medical school to choosing a specialty. Our podcast will provide essential information for anyone contemplating a career in medicine.
Hi everyone, my name is Yash, and today I'm going to be giving a quick intro into what a BSMD direct program is. Give a quick introduction to what exactly a BSMD direct program might entail, as well as provide some questions and leading kind of thoughts for how people looking at BSMD programs should start thinking about them and the questions that they should answer themselves in order to better guide their process of thinking about direct programs, applying to direct programs, finding direct programs, all important things to think about when making your college decisions. So let's get started. First off, let's talk about what exactly is a direct program. So a direct program, at the crux of all of them, is this idea of a conditional acceptance to a medical school right out of high school. So this is the idea that, when you're accepting an undergraduate college after you graduate 12th grade or senior year of high school in the United States, you'll also have some kind of conditional acceptance to a medical school for the future. That is either 2, 3, or 4 years out in the future. You'll have that conditional acceptance right in high school, when you're graduating high school, that is. Obviously the biggest pro or biggest advantage of this is that you get to skip the formal medical school application process. That takes up a bunch of time, is pretty difficult and very tedious as well. Most pre-medical students spend, their last 2 years of college dealing with this process, and getting to bypass it because you have conditional acceptance gives the applicant and the student a lot of free time during their pre-medical years to pursue other interests and passions. Now that being said, direct programs are not all the same. They can be different in length. So 6, 7, and 8-year programs exist. 8 years is the typical 4 years of undergrad, 4 years of medical school. A 7-year program will be still 4 years of medical school, but then 3 years of undergrad. So it's a condensed undergrad. And 6 years is the same thing, still 4 years of medical school, but 2 years of undergrad. So an extremely condensed undergrad. And what we've been seeing so far is that very recently, these 6-year programs seem to become more and more kind of retired, and they seem to be getting scrapped more. So these 7 and 8-year programs are really dominating or the landscape for BSMD so far. But that being said, 6-year programs still do exist. So as I said, lots of different types, and these different programs can also differ in terms of the requirements. So as I mentioned in the first bullet point, all these acceptances to medical school are conditional, and they're conditioned based on requirements that can differ from program to program. Two main ways that they differ are MCAT and GPA requirements. So MCAT is the medical college admissions test, and it's a test that's pretty difficult and most pre-medical students spend many months preparing for. Direct programs differ in the sense that some programs do not require you to take the MCAT at all. Some programs require you to take the MCAT, but may not need you to report a score, or that is, they don't really necessitate a certain score. And the third type of program will require you to take the MCAT, and then they necessitate at least minimum score as well. So there's a necessary minimum score that you have to reach on the MCAT for those third kinds of programs. And then secondly, GPA. Almost every program requires some kind of minimum GPA in order to matriculate to the medical school after 2, 3, or 4 years. What this requirement is can differ. I mentioned these two in bullet points because they're the most common requirements, but there are other requirements as well that many programs can differ on. Some programs can require research requirements, some programs can require language requirements, and others can require shadowing or volunteer requirements as well. So it's important to look at these and think about all of these different requirements when looking and evaluating different direct programs. But the thing I want to leave you with is what makes a direct program. As I said, it's this conditional acceptance to a medical school out of high school. So let's talk about some examples. Northwestern offers an honors program in medical education. It's a 7 or 8 year program. Both the medical school and undergraduate school are through Northwestern. Brown offers a similar program. It's called a Program in Liberal Medical Education. That's an 8-year program. Again, completely occurs at Brown. Penn State offers a program through both Penn State and then Jefferson Medical School. Undergraduate studies occur at Penn State, and the medical school education occurs at Jefferson. And this is called a pre-medical medical program, and it's a 7-year program. The University of Pittsburgh Guaranteed Admissions Program is an 8-year program, completely through the University of Pittsburgh. And then Boston University, the Liberal Arts / Medical Education Program is a 7-year program completely offered through the Boston University. So these are just 5 examples of a countless list, but these are some of the most kind of known programs. And as you can see, they also differ in length. Some are 7, some are 8. They also differ in terms of whether the entire program occurs at one institution or at 2 different institutions. There are a few instances that are similar to Penn State Jefferson, where institutions are tied with each other, where you complete half of your studies, your undergraduate studies at one institution, and the medical portion of your studies at another institution. So these are things to look for, and I thought it would be nice to give everyone a kind of rundown of some more of the famous examples of what these programs are. Next, let's get into the questions of what I think, or we think, that people should be thinking about when they first encounter direct programs or the idea of a direct program. Number 1, why do I really want this? Number 2, what would I do with more free time in college? And number 3, do I understand and feel prepared to take on the challenges of being a pre-medical student? I think these questions are super important, and I really urge you to take some time to think about these in the context of a direct program. Because that'll be very worthy to you and to your family to understand really stuff about yourself and direct programs and being a physician. But also, if you can answer these questions well, it's really going to help your college application and direct medical program application process as well. So think about that. Think about why direct program might be for you. What would you do with the advantages? What would you do with the free time? As I mentioned, that formal medical college application process is very tedious, takes a lot of time. If you don't have to complete that, you'll have a lot of free time. What are your passions, your interests beyond medicine that you want to pursue with this free time? Like, what would you make use of with the advantage of having that free time and being in a combined program? And then number 3, I think, is applicable to anyone who wants to be a physician or enter down this pathway of becoming a physician, is, do I understand and feel prepared to be a pre-medical student? A combined program is not easier in the sense of coursework or the challenges of being a pre-med student. Apart from having the conditional acceptance, you still have to work pretty hard. The coursework is pretty grueling, and the time management skills necessary to get through it are crucial. So yeah, anyone who's going down a direct medical program should understand that, it's not just a walk in the park. It's still going to be challenging. And is this for me? Do I really want to be a physician? Why do I want this? All these questions go together. But I think number 3 goes hand in hand with maybe number 1. And if you can answer all these questions, you'll be a great applicant. You'll really understand, more importantly, why a direct program is good for you. And more specifically, you might be able to narrow down which direct programs are good for you. Now, there's also another list of more specific things to think about once you've thought about those 3. I think a lot of them go hand in hand with the first 3, but we'll get to those as well. So number 1, how long do you want your undergraduate career to last? What interests are you planning to pursue in college? Are you willing to stay in the same college or place for a long time, up to 8 years? And lastly, how important is the prestige of an undergraduate institution to you? Now, I'll give a quick kind of couple sentences about each of these. First, how long do you want your undergraduate career to last? Why is this important? As I mentioned, direct programs can differ in length. They can be 6, 7, or 8 years. If you're someone who wants 4 years of an undergraduate experience, you have to really look for somewhere that is either 7 years or 8 years, is either 8 years or a 7-year program, which will allow you a 4th year if you so choose. If you're someone who's okay with an extremely condensed undergraduate experience, then even a 6-year program is fine for you. This is something to think about. What interests are you planning to pursue in college? I think this goes hand in hand with the question from the earlier slide of what would you do with free time? And also to think about these interests in the scope of the direct programs that you're looking at. You want to make sure that you're capable of finding those interests at those institutions, and you have the time for them as well. Number 3, are you willing to stay in the same college and place for a long time? As I mentioned, a lot of these programs are through the same institution. So you might be spending up to 8 years in the same place. Are you someone who likes to change scenery, who likes to travel from place to place and doesn't necessarily want to spend time in one place for 8 years? Or is this something that you're okay with? Again, these are things to think about. And lastly, how important is the prestige of an undergraduate institution to you? A lot of the applicants who are going to be great for combined programs are also going to be great for a lot of the elite undergraduate institutions. But not a lot of the elite undergraduate institutions offer direct programs. So when you're looking at these programs and you're looking at other undergraduate institutions, a lot of times applicants have to make a decision. Do they value the prestige of an undergraduate institution over conditional acceptance to medical school? This is a question you have to answer yourself, but sometimes it's very difficult to get both in the same setting, as many direct programs offer access to great medical schools, but perhaps not the most prestigious of undergraduate institutions. So these are just things to think about. As I mentioned, this video was mainly made to give an intro to what a BSMD program is. I hope you can kind of understand the basics of it, that it's a conditional acceptance to medical school, where at the end of 8 years, you'll walk away with both a bachelor's degree of some kind as well as a medical degree. The bachelor's degree typically comes after your first 2, 3, or 4 years, and then your medical degree, at the end of the program. But next time, there are a few things that we'll flesh out for sure, like the questions listed earlier. We'll do a deeper dive. We'll talk about how you should feel about certain answers, what you should be pursuing based on what you answer to those questions, and what direct programs might be looking for in terms of those. 2, I think this is probably going to be the focus of the next video, is that the pros and cons of BSMD programs. So there are a lot of ideas out there of what certain pros are and what certain cons are, but I think we'll be able to flesh those out better. And while doing so, we'll dispel some myths and identify some truths as well, and maybe some uncommon truths. And I think this will be very helpful in terms of better understanding what a BSMD program can offer to a student and what they can't offer to a student.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com and medschoolcoach.com for more essential resources in your medical school journey and beyond.